Hello and welcome to our podcast channel Urology for Everyone. This is Dr. Girish Nelivigi, urologist and andrologist from Nelivigi Multispeciality and Urology Hospital in Bangalore. Today, I'll be discussing a urology topic which is common but at the same time serious. And this is called pyelonephritis. Pyelonephritis means infection of the kidney. What causes infection of the kidney? What are the symptoms? How to evaluate it and how to treat it is what I'm going to discuss today. A person with infection of the kidney could be a male or a female or rarely a child also. What are the symptoms of infection of the kidney? The patient presents with pain in the abdomen, more in the back. The kidneys are situated on the flanks, so the patient will say the pain is more on the left side or on the right side in the back. There could be chills, there could be shivering, there could be pain in the back, and very importantly, high grade fever which is swinging. The patient may also suffer from difficulty in urination in the form of burning sensation when he or she passes urine. There could be urgency in passing urine, or there could be increased frequency in urination. When a patient presents with these symptoms to the urologist thinks of infection of the kidney and does physical examination to see if there is any pain in the region of the kidney. And also, a series of tests are done to confirm infection of the kidney. These are blood tests, kidney function tests called creatinine, urine routine examination, urine culture to see the bacteria that is growing, and also ultrasound of the abdomen to confirm the diagnosis as well as to see what is the cause for infection of the kidney. Now, what are the causes for kidney infection? In our country, the most common cause for infection of the kidney nowadays is diabetes. Invariably, the patient says he or she is a diabetic when they present with infection of the kidney. They are overweight and they are elderly. The other causes for infection of the kidney are stones in the kidney or stones in the ureter which block the kidney, or any blockage or narrowing of the urinary tract like in the ureter or in the kidney itself, or lower down in the region of the bladder and the prostate. There could be some anatomical abnormality of the kidney which could also predispose to pyelonephritis. These things usually are detected on evaluation. What is the treatment for infection of the kidney or pyelonephritis? The treatment consists of antibiotics, and usually if the infection is severe, it is better to give injection antibiotics. If the infection is mild, then oral tablets, antibiotics may suffice. The treatment is given for minimum of 10 days because kidney infection is a serious infection. And many times the patients need to be hospitalized because they are dehydrated, they are vomiting, and they have got severe weakness. So in the hospital, they are given IV and fluids and injections to reduce vomiting and also to reduce gastritis, and injection antibiotics. Once the symptoms are reduced or they go away, then they can be converted to oral antibiotics. Meanwhile, control of diabetes is very important and it is done aggressively. Sometimes if diabetes cannot be controlled by tablets, it has to be done using insulin. Now, what happens to a patient with pyelonephritis? I told it's a serious infection, but does it have any long-term effects? Luckily, most of the pyelonephritis or kidney infections, they resolve with antibiotics and they do not leave any long-term imprint. So the patient has to visit the urologist, get himself treated promptly so that no long-term sequelae are found. So thank you very much for listening, and I will be back with another podcast episode